My name is Sherry Menor-McNamara. I am the President and CEO of the Chamber of Commerce of Hawaii. I don't know about you, but I'm surely interested in this session because it's something that the Chamber has been talking about on a regular basis, and now with the Affordable Care Act, it's something that we're looking into to see what we can do, at least for our membership. And so I'm sure we'll learn a lot from our speakers today. So I need to read a session description according to my instructions. So this session, it's about better health and sustainability depend on assisting employees with healthier habits. Worksite wellness programs bring clear benefits for the employer, insurance premium stability, and a mentally and physically healthy workforce with reduced absenteeism and increased productivity. You'll learn from these representatives from small, medium, large businesses about their practices and the tangible results they have seen since instituting the programs. So I will provide a brief bio of each speaker in the order that they will speak. And we are going to start off with Matt Delaney, CEO of Hawaii Group and also an active chamber member. Mr. Delaney is the co-founder and CEO of the Hawaii Group, a family of companies that includes Hawaii HR, Hawaii Accounting, Hawaii Employment, Hawaii Healthcare, and Hawaii Marketing. And I'm sure that's not going to be the end. I'm sure we'll see more. Companies that operate in the state's human resources, accounting, healthcare, and marketing industries. Hawaii Group is now the state's second largest outsourcing company, serving over 600 client companies and over 7,500 employees. Prior to founding Hawaii Group in 2009, he served in various executive level positions throughout Hawaii, including as development manager for the Royal Lahaina Development Group, and before that as vice president of Hawaiian Hotels and Resorts, and CEO and president of Mark Resorts Hawaii. So please help me in welcoming Matt Delaney. After Matt, we'll have Andi, okay, I just asked for Verbovanec. Did I get it right? Close, okay, sorry. Clinical Administrative Coordinator and Wellness Champ of UnitedHealthcare. She moved to Honolulu from Seattle over 10 years ago to attend the University of Hawaii. By the time she graduated with a BA in zoology, she had fallen in love with the land, the culture, and the people of Hawaii. So she decided to permanently trade the rain for rainbows. Good choice. She has been with the UnitedHealthcare since 2011 and enjoys encouraging everyone to live healthier lives. Please help me in welcoming Andi. And finally, we have Travis Clegg, Vice President of Operations of Castle Medical Center. Travis has executive responsibility for the medical center's laboratory, physical therapy, radiology, respiratory, and wellness departments, as well as various support departments. He also oversees leadership development, construction and renovation, and employee wellness. He received his MBA from Portland State University and is a member of the American College of Healthcare Executives. Travis is a passionate advocate for service excellence and has been a national presenter on the topics of alignment and accountability. He lives in Kailua and enjoys hiking and kayaking with his family. Once again, please help me welcome Travis. So as mentioned, we're going to start with Matt, and you will have an opportunity to ask questions after their presentations. Okay, Matt?
Aloha, everyone. Let's see how to do this. I was asked today to come talk about health and wellness and how it relates to small businesses and how people can implement new ideas. As Sherry mentioned, the Hawaii Group represents 600 different businesses throughout the state, and we also have operations on the mainland. And health and wellness is nothing new, but it's now such a hot topic, especially with the new PPACA and ways we can benefit from it. is you're seeing across the country and here too a lot more health and wellness degrees, a lot more nutrition degrees, a lot more health and wellness companies or advisors or consultants popping up everywhere to really do the right thing at the end of the day. You know, we're all here. I'm so impressed with the turnout in the downstairs room for this conference. It's just amazing, and such powerful people here in the room. Is we're all learning about Obamacare day by day, and I think we could all come to a summit like this every day and keep learning and get even more confused with the 15,000 pages of laws and rules that are still being worked on. And from an employer standpoint, every time we try and advise our clients how Obamacare is going to impact them, the next day something seems to change. You all probably were aware of these notices that you had to send out by October 1st by law to all your employees, and then they scrapped that whole kind of enforcement. Employer mandates have been deferred. Things just keep continuing to change state by state and on a federal basis. But really, if you take a step back, our forefathers in Hawaii here, don't know what side of the fence you look at, but since 1974 with the prepaid health care, they were really way ahead of Obamacare. And if I was a betting man, fast forward, 10 years from now, Obamacare is going to look like prepaid health care. From a participation standpoint on the mainland, let's say you're in Idaho in a construction company, what are benefits? You don't give anybody benefits. If you're a restaurant, you don't give anybody benefits. Here in Hawaii, if you have one employee that works 20 hours or more for 4 consecutive weeks, we just know we have to provide health care. We don't try and avoid it. And Obamacare is 50 employees or more and working 30 hours or more. So you've probably read about these national companies like the movie theaters. Their quick way around it is to change all their work weeks to 29 hours a week, and now they don't have to provide health care, which kind of dodges the whole intent of providing health care to everybody and making it kind of an equal opportunity to get health care if you don't have access to it. So from a eligibility standpoint, Obamacare doesn't really mean much for us. It's all the compliance, the reporting, the new requirements you have to put on everybody's paycheck, defining how much benefits cost, and things like health and wellness that can potentially impact your healthcare rates in the future. So today we're going to talk a little bit about the immediate and the future impacts of health and wellness. In health and wellness, it's so hard to measure. I don't know too many businesses that have a complete stable set of employees. If you had a stable set of employees for the next 10 years, you could clearly quantify and track health and wellness and the impact it has on your healthcare rates. But as you have turnover or growth, employees come and go, you start new things, it's really hard to truly quantify health and wellness. We can all say it provides more productivity, people are healthier, lower healthcare costs, but how do you really measure it? And I think the trend is really to start putting things in place that give employers the ability to give discounts and other things to employees that are healthy. But for small and medium-sized businesses, I know a lot of the large businesses, they have director of health and wellness. We've got a wellness champ here on our expert panel. It's the trend. It's really a valuable position that wasn't really thought of before. But so ways small companies can do it is to outsource the function, hire a health and wellness advisor on a retainer or hourly basis, or just hire somebody to help implement a plan, because your typical small business can't afford a health and wellness director. So it's kind of quantifying your out-of-pocket overhead to have this position or this consultant, and will it pay benefits down the road? And I think long-term it will pay dividends, but again, how do you really measure it? It's a tough thing to do, but we all know it's the right thing. We know we should drink less. We should stop eating at fast food. It's like speeding. The speed limit's 55, but we keep speeding at 65 until we get caught. Well, from a health perspective, you keep going until something really happens bad to you that's medically related, where you finally wake up and go, okay, I should have stopped eating red meat 7 days a week. But how do we encourage our staff to do that? So really part of the whole Obamacare is really is in the downstairs session, talk about us as individuals taking care and accountability for our own health. It's not our employer's job, but how can our employers really motivate you and incentivize you to take care of your health, not only for selfish reasons as an employer, more productivity, happier people, longer tenure, and ultimately to drive the cost down of your healthcare. So if you weren't familiar, there's incentives and penalties that can be, let me flip forward here, that really can be implemented in your organizations. Currently, the PPACA has an eligibility of 30%. And just to kind of explain it, if you have employees that are overweight or diabetes or not exercising, and you put things in place now for them to start participating in health and wellness, you have the ability to up to 30% give them a discount. Or, and I'll show you in a second, different ways you can pay them. And PPACA actually also has verbiage in there of up to 50% for smoking cessation. So it's the whole point of trying to encourage your workforce to be healthier, take wellness seriously, and really focus on that end benefit, because even though perhaps the employee has healthcare coverage, often they're paying for their dependent coverage, their spouse, their kids. So there's generally always a buy-up or a buy-up for dental or something that's not included. So there's ways that employers now can actually give incentives to HIPAA currently allows for 20%, but really I'm not familiar with too many companies here in Hawaii that actually give their employees benefits or reduction in their healthcare costs for these. Again, the PPACA now has 30%. It's going to increase to 50% for smoking cessation. The last bullet point is there's federal grants for small employers. But from my experience, to be honest, it's kind of like the medical premium tax credit. It's very hard to qualify. It's very convoluted. You're going to spend more often with your accountant to figure out if there's a premium tax credit for you. Same kind of thing. There's federal grants out there, but it's very hard to actually qualify. But encourage people to look and see if you might qualify for it. So again, a way to really kind of partner with somebody, because most small businesses in Hawaii, 89% of all businesses are 19 or fewer employees, and 90% of those have 9 or fewer. That's kind of how we track small business in Hawaii, but Obamacare is 50 employees or less, which to Hawaii is a pretty big company. But really suggest hiring an advisory firm, outsource the function. There's benefit brokers now that are becoming experts in health and wellness, or health and wellness advisors, to really help you implement a plan if that's something that is your goal as the employer. Ultimately, it's going to help preserve competitive rates upon renewal. We all know year after year there are double-digit increases, especially here in Hawaii. Again, if you can control your health costs, there's actually the potential for it to go down. That's the ultimate goal with Obamacare, is to drive the costs down. Will it happen in the near term? That's really for everybody to find out. It can assist with recruitment, retention, of course, improve attendance, turnover, and really larger groups are even more impacted when they're spending $50,000, $100,000 a month in premiums. Individual utilization really plays a role in that. So kind of one way to say this is, hey, employees, here's our new health and wellness program. It's these 5 different criteria. If you're a smoker, we'll help you pay for programs to have you stop smoking. If you're overweight, we'll help you get some preventative care. We have gym memberships. We have these things. Again, you then, next year upon renewal, for everybody that participates, can offer them a discount. Now, that discount's coming out of your pocket as the employer, but if it's driving down your healthcare costs in the long run, you're the one that's going to be benefiting the employer. When renewals come, people that don't participate, they won't get a discount or won't get an additional program you can offer. So that's kind of a new thing that I don't see very often here in Hawaii, but a lot of our clients, 600 around all the different islands, are now starting to ask, how can we have a health and wellness program to benefit? Kind of went over this. So some ways that you can do this, again, merely giving them a discount on their health care or their dependent buy-up. You can, if you don't pay for dental, say if you participate in health and wellness, we'll pay for your dental. Gift cards, health savings accounts is kind of the new trend where you'll put money into an account, and now they can use that for their co-pays or all their out-of-pocket expenses. So there's really creative ways that different companies are trying to encourage their team to get involved. And really, from my own opinion, if the government really wants to drive health and wellness, they should be offering even more incentives. So it's at least a start. We'll see how Obamacare unfolds. It's a step in the right direction, but to really bend the cost curve down, the government should really be giving us much more higher incentives, really from the employer down to the individuals to become healthier. It's kind of in Hawaii every year in the legislative session, the controversy over solar tax credits. If the government wants us to put solar up, they're going to give us big tax credits. As soon as the tax credits go away, people are going to stop putting up solar. So if they really want us to be healthy, give us even bigger incentives to be healthier. Only got a couple minutes left. So lastly, I just want to touch base on our group, the Hawaii group. We actually now have a director of health and wellness. That's his job, is to make sure we're healthy. We have team workouts every week, do CrossFit right in our office. We happen to have a facility that encourages it. We have clients come out. We have some of our healthcare partners come out. And we are constantly doing activities. Each of our departments every month puts on some activity, whether it's a run, a walk, a hike, a swim, a paddleboard. We actually get points for participating in individual things and company things. And then there's incentives, iPads, gift cards, restaurant gift cards. So we really encourage our staff to get healthy. We feed our staff. Now we're providing them nutritional meals instead of the plate lunches like we used to. We're really trying to get healthy with the team. And I got less than a minute left, 4 branches of wellness of what we happen to do. We have an occupational intellectual branch. Really, we believe in continuing to educate, train, learn. We want our staff to get the next certification, their next license, their next degree. We pay for that. Social, we really believe in giving back to the community and help those that are less fortunate than us. So our team, not only health and wellness, is also giving back. They get points, per se, for going to volunteer out in the community for whatever their passion is, and also our company-sponsored events. Emotional and spiritual, we really push family balance, try and reduce stress, which is hard. We have a nutritionist come in and help educate our staff. And lastly, what we've talked about today, the physical piece of getting healthy, taking charge of your own life. We do it internally, and we do it for our clients. And it's a really kind of next step, which is really on the mainland taking off in Hawaii. We are already such a great culture, great weather here. People are in great shape here on average versus the rest of the mainland. So let's keep pushing forward and make our workforce much healthier and take responsibility for them. Thank you.
Verbovanec. I am a clinical administrative coordinator for UnitedHealthcare Hawaii. I'm also our site's wellness champ, which I will get into later. And because everybody always asks, my last name is Bohemian. So, excuse me. Helping people live healthier lives is the motto for UnitedHealthcare. And at UnitedHealthcare, we understand not only is it for our members to live healthier lives, it needs to start at the employee level as well. Studies have shown that sitting at a desk 8 hours or more a day has negative physical effects, such as slouching can cause arthritis and bursitis. And bursitis is the inflammation of the bursae, which are found between your joints, between your bones, between your muscles. So basically, the choice is there to have a healthier diet, even if it's not something that you can bring from home. It's still convenient for them. So we have many different programs in our company to promote healthier lifestyles for our employees. We have programs for health, payment programs, support programs, and then we have the Wellness Champ, which also helps with our Fit Challenge that we do annually. So some of the programs we have for health, we are a tobacco-free workplace. What this means is it's a company policy that there is to be no tobacco use within 500 yards of the building. And that includes those of us sites that rent space from another building. We are still supposed to adhere to that 500-yard policy. We also have a healthy joint program, healthy weight program, kidney resource services, telephonic wellness coaching, which is where employees can call and be directed to the different programs that they might need to increase their healthy lifestyle. And then we also have what's called Parent Steps. And Parent Steps is resources for those of our employees who are going through fertility treatments or would like to start. So in our employer support, we have the healthcare flexible spending account, which Matt actually talked about. We also have reimbursement accounts, both for dependent care and commuter expense. We have cancer support services, Solution for Caregivers, which is a program for employees to help take care of their loved ones, even if that loved one is on the mainland. It's a way to coordinate services for that loved one and make sure they're getting the services that they need. And then we also have the Employee Assistance Program, which employees can call and be directed to different resources, not only for physical health, but for mental health as well. So the Wellness Champ, as a Wellness Champ, my role is to help promote these healthy lifestyles and these healthy choices. I help direct staff to the various programs that are available to us. I also work to implement staff suggestions in ways that they think that we could become a healthier workplace as well. I meet nationally with my counterparts on the mainland, and I send out weekly emails to help promote healthy lifestyles. One of the emails that I send out to everyone is it's a recipe each week that focuses on using fresh fruits and vegetables. And the reason I did that was to promote going to the various farmers market around the islands. In downtown, we have the Fort Street Farmers Market that meets twice a week. So not only does it encourage our employees to eat healthier, it also promotes the local economy, which helps out our communities as well. Another role I have is to have face-to-face interactions with our employees to help encourage them. If they feel like they're struggling, they can come to me and ask and have that face-to-face talk. I also send out a weekly exercise reminder, just as a reminder. Not only does it give them exercises they can do at their desk, but we live in Hawaii. Get away from your desk, go outside, go enjoy the weather. You know, right now, I'm from Seattle. They're looking at whether the first frost is coming. Is there going to be snow for Thanksgiving? We have a special lifestyle here, and we should be encouraging not only each other to do it, but also in a way we could encourage our members to do that as well. So some of the challenges that we face, because we are a national company, trying to get local discounts is a bit challenging. We have to have a company contract with them, and that involves a lot of steps and paperwork. Also, for when we do contests, the prizes, the amount of your prize, you can actually get taxed on. So when we have these contests, who's going to pay the taxes? Are we going to have a prize that's low enough that we don't have to worry about the taxes? And then for me as the Wellness Champ, my biggest challenge is our telecommuters. More and more companies these days are having telecommuters, and how do you keep them involved with everybody else who has to come into the office? And that's one of the reasons I started sending out emails, is so that they can feel included and to also encourage them as well. We are thinking about you. We do care about your health as well. So the future. We're going to, of course, continue our current programs, but we're always looking for new opportunities and new improvements. Coming here today, hope to learn some other things that we could hopefully implement in our company as well. So, thank you.
Well, I'm Travis Clegg. I'm the Vice President of Operations at Castle Medical Center, and I'm very excited to be able to come and talk to you today about something I'm passionate about, which is our wellness program. Some of the best tips that I've picked up over the last year, and maybe some challenges that we've encountered. I've been here at Castle for 2 years, working in healthcare since 2004. And I want to tell you about Castle Medical Center just for a minute. before we get started. This is Castle Memorial Hospital 50 years ago. This is actually our 50th anniversary, so we've had a lot of fun celebrating that this year. But you look back, and wow, so much has changed. This was in 1963. We had 72 beds, an ER, I think we had 4 beds, birth center, and an intensive care unit. And things that made the newspaper headlines in 1963 where air conditioning was available in the hospital. We had toilets in every patient room. We had a state-of-the-art X-ray, which was awesome. And we had parking for 100 cars, which was just amazing. So fast forward 50 years, and this is Castle Medical Center today. Of course, we still have our birth center, our ICU, and our ER, but now we're a 160-bed hospital, and we're seeing over 30,000 patients a year just in our ER. The parking, if it was only 100 spots today, would be a nightmare. So a little bit about Castle. We are also part of the Seventh-day Adventist Healthcare company. So Adventist Health is a West Coast-based healthcare system founded on the principles of the Adventist Church, which has a very long history in wellness. And I wanted to share a few interesting items. This is actually one of the original hospitals. Back in the 1890s, they were called sanitariums. And this is Loma Linda, California. People came here to get well when they were sick, but it was not the typical hospital that you think of today. They had people, early pioneers, who were really interested in healthy eating, fresh air, clean water, diet, and exercise. This is one of the ones who was very excited about good diet. His name's John Harvey Kellogg. You may have heard of his product, Corn Flakes, he came up with back then. And we actually found some cool pictures of people. These are actually patients coming to the hospital or the wellness center and doing calisthenics outside. You know, you don't really see that anymore, but this was part of the kind of the culture of the day. So we are proud that we've been able to carry that culture forward. This is Nicole, our director of wellness, and this is down in our bistro, our cafeteria. We actually have a miniature farmer's market that we have fresh local produce brought in through the cafeteria and made available for purchase at price. So we get wholesale price on this every day for our guests, visitors, and of course our associates. And we think that's been a really successful idea. So against that background, I want to switch and talk about costs, because I think if you're an employer in the room or if you're an employee and you're paying premiums, you've all seen the rising cost of healthcare. This is a study that Modern Healthcare did a couple years ago, comparing hospital workers to the average worker in terms of cost in the U.S. They found hospitals were significantly more expensive, mainly because hospital employees tend to go to the ER more often when they are sick. When they go to admitted to the hospital, they stay longer. Maybe it's because they know people. Regardless, they spend a lot more, and we're seeing that problem. As others have seen their costs rise, so have we. And so kind of against that background of wellness, the cost challenges that we're facing, we decided to form a team. So this was last year. We had a multidisciplinary team that we put together at the hospital. This is representing clinical, lots of different ages, administrative folks, people from even the chaplains in there. And we had a goal of creating a wellness program that would do 3 things. 1, we wanted it to be accessible, so something that was anyone could participate in. 2, we wanted it to be more than just physical activity, because there's so much more to wellness than just doing things. We want people to learn, we want them to take care of themselves through going to their doctors. And lastly, we wanted it to be a lot of fun. So we launched our program in January, and we call it LivingWell. And I'm going to just walk through a few of the aspects of the program with you. First of all, we ask our associates to take a biometric screening. That's going and getting your lab drawn at the doctor's office, or you can come, if you're an associate, to one of our labs and get it done for free to get your basic baseline health information through your blood work. You then take that information, you put it into something called a health risk assessment online. It takes about 30 minutes. It's part of the program. And once you're done with that, we call it engaged. You're now engaged in the program. So once you're engaged, you can start doing the fun stuff, and that's earning points. So we have a total of 100 points that we're looking for in the course of a year, and we broke those up into different categories. We talked about just a minute ago, doing things. You can get points for going out and being active. Learning things, we gave you a bucket of up to 30 points. You could earn points from learning, like going to a seminar or reading a book about healthy living, or even just watching a documentary, anything. And self-care, that's actually going to your primary care physician at least once during the year, and then following up on any recommendations that they made as far as screening. And this is a really important link we found because of all of the people not going to their physicians. We were shocked to find that our associates were one of the highest groups of non-compliant people. So if you're a healthcare worker, you may recognize that phenomenon. Throughout the year, we also gave away a lot of prizes. So I forgot to mention, at the end of the year, if you've done this and you've got 100 points, we give you an extra day off work. So we think that's a really fun reward in recognition for participating. But throughout the year, we've created a lot of opportunities to win prizes. And I've heard a lot of people talking about prizes. So 3 times this year, we drew names for people who were participating and gave them 2 tickets to inter-island trips or $500 if that's something that they were interested in. We wanted to sustain momentum because we had a lot of excitement around this program when we launched in January. I think we had over half of our associates actually come and attend one of the workshops, get the booklets, and very interested. But you know how that tends to taper off throughout the year. You have a big launch and it tapers off. So our goal here was to create regular physical challenges, special events, like the one you see here is a plant exchange that we sponsored. Come and, it's free, it's sponsored by the hospital. Come and learn about gardening and also pick up a free plant. We have some very, excited people who are also our partners in bringing that out. We also did some discounts. So that little shaka up there, the LivingWell shaka, gets you a discount in our bistro. If you've participated in the program, you get discounts on salads. So lots of ways that we've tried to find throughout the year to link all this together. There are some learnings I want to share with you, and that's strive for progress, not perfection. I think we wanted to have 80% of our associates complete by the end of the year. And while we had a strong start, sustaining that momentum has been very difficult. And you have people working, not even finding time to take breaks some days, and trying to get them to engage in this program has been very difficult. You're talking to a birth center nurse who's been, on a 12-hour shift. I don't have time for that. So by the end of the year, we're happy that we've got about 30% of those original people who've signed up and engaged in the program actually looking like they're going to complete it, but it's not enough. So progress, not perfection. I think also it's important to have top leadership support. That's our CEO, Kathy Rathel. She is doing the Fit 59 Challenge. This is something that she came up with early in the year and involved a lot of different activities, all driven straight from the top. Also, you need to communicate a lot of different ways. I've heard a lot of it already this morning with emails, weekly meetings. We assign buddies to different people to try to keep the word going. But even that, probably 4 or 5 ways that we came up with is not enough. We need to come up with at least 10 different ways. And then celebrate. When we won the large employer, healthiest employer for the 2nd year in a row, we threw a big celebration. We were so excited. But don't just celebrate the big things, celebrate the little things. One of our challenges involved the stairwell to heaven, which is going up and down our stairwell, the equivalent of climbing the stairway to heaven. So this was the gal who won that. And we made a big deal about it, brought her a prize, put her in our newsletter, and it's those little things that really can matter. Lastly, in closing, the reasons why we do this. This is our mission statement, caring for our community and sharing God's love. And we believe our community starts right at home with our associates. So we need to care for them. So we really see it as part of who we are and what we do. But there's also reasons, and I challenge folks, there's personal reasons that you all want to be engaged, and we just need to remind folks, what's your reason? And I thought it'd be fun to share with you what my reason was. So that's my reason for wanting to stay engaged in our wellness program, stay healthy, and be here for a long time. That's my 3-month-old daughter, Violet. So there we go. That's my presentation. Thank you.
Good job to all of you. Very good information. Travis, I just got to ask, Matt and I were saying, how do you get the water moving? That's pretty cool.
Yeah, we have a PowerPoint guru who helped me with that.
Oh my gosh, I want to borrow that person. Okay, well, I'm going to open it up to questions now. So, any first takers? And there's a microphone right there, as you can see. There's got to be some questions out there. All right.
I was wondering how the Affordable Care Act and your wellness programs interact with the world of organized labor and unions and the kinds of things that are often in union contracts, even if you don't have it.
Since you have unions.
Well, I will try to speak to that. We actually don't have any unions at our hospital. We're one of the few, I think, here on the island that aren't union. However, the reason I think that is that we have offered exceptional benefits over the course of the last 50 years, and we're always looking to enhance those benefits. For example, with this program, you didn't hear me talking a lot about premiums and the decrease in premiums, and that's because we actually don't have any premium cost for if you're a single employee without a family. At the very basic level, there's no cost to the employee. So things like that we actually struggled with at the Wellness Committee because we wanted to offer an incentive, but when you're not paying anything, you can't really do a whole lot better than that. So we started doing these different prizes. And it's something that we plan to look at in terms of 2014 when we roll out changes to our program. We will probably at some point need to introduce some benefits link that actually has a penalty if you don't participate. And I think that's really been shown through studies to increase the participation rate. I didn't get a chance to mention it, but our parent corporation, who's been doing this for a couple of years, saw their health premiums that had been rising from 8 to 12% a year. When they started this program 2 years ago, the first year that they did it, they saw a flat cost increase, so no cost increase over the prior year. This year, the second year of implementation, they've linked in participation to the benefits such that if you don't participate, your premiums do go up. And they've seen a decrease in cost and an overall increase in satisfaction when they do the satisfaction survey. So I think that doesn't directly answer the question, but I do think that those are things that we're watching. And as an employer, we want to make sure that we're engaged with our associates so that that's not an option that they feel that they need. Is that fair?
Mm-hmm. Anybody else? Okay. Any other questions?
I have to apologize for coming a little bit late, so you may have talked about this while I wasn't here. Is anything being done to encourage people to grow their own food? I know you guys eat a lot of vegetables.
We do. We have a lot of passionate people who are really involved in the local farming scene. So in addition to what you saw there, we have a garden that we grow on the campus of Castle Medical Center. Some of our foods that we serve not only to our patients but also to our associates. And we have folks who volunteer time to teach people who are interested about how to do sustainable farming. Even if you only have a deck in the backyard, you can still do potted plants and things like that. Anyone else?
There's a lot of, again, nutritionists are coming into various companies now and educating people on what we all know is how to eat healthier, but we just don't do it. What's really not kind of hardwired into Obamacare, at least what I've seen yet, is any kind of incentive for that. So companies are encouraging it like them, or go down to the farmer's market, as she mentioned, and again, get points, or it's participating in your company events and showing your loyalty to your team and your employer. But I haven't seen any direct kind of incentives correlating to growing your own stuff yet at this point. Will that change in the future? Hopefully.
Okay. Next question.
Could be a couple of parts to the question. One of them, if people are looking to sort of use wellness to sort of lower their premium, and you can see that that's where it's going, in order to do that, you've got to get a lot of the data from your insurance company to help you kind of look at that. Have you guys had success in getting that from the insurance? And certainly Castle has that, and United obviously has their stuff. But for a lot of the smaller companies, it's hard to get that data. And most of the decision, basically, here's the letter from insurance company A, here's a letter from insurance company B, this one's smaller, we're going with A. It's as simple as that. So that's one part. The other part is, what do you do when you're doing your wellness and you have the person that you know is obviously overweight or may have some other problems, or is a smoker that just doesn't want to play? So talking about the incentives and things that you're doing there, that's one. But the other is, what can an employer do to try to get some of that data from their insurance company to try to help get those premiums down, so you can actually have some of that discussion with the insurer to try to do it? Because everyone understands it's a good thing to do, to try to do the wellness, but how do you actually make that happen in practicality?
I'll take the first one. There are certain HIPAA laws for very, very small companies that they can't release the utilization. You know, if you're a one-employee company, you can figure out who got cancer. But I forget what that threshold is, but you have a right to that utilization data through your carrier, not only if you're going to switch health plans, but so you can at least gauge it. Now, they can't share with you on an individual basis who got sick, who didn't, who got cancer, who didn't. Depending how big you are, you might be able to figure it out, but that's why the HIPAA laws are there. But you have a right to that utilization data, at least, right? Your premiums paid in and your charges or utilization, and that's how they renew you. Obviously, if you have a big claim, generally most health insurers are not going to lower your rates unless there's some real story as to a change in your business or your employee status, but would highly recommend that you get that info, and you can start, again, monitoring it. The more stable your business is, it's easier to kind of quantify year by year. If you have a lot of turnover or change, it's really hard to figure out, hey, we had 10 employees, but 5 left and 5 are new. It kind of throws the whole spectrum of premiums versus charges, but that's a way really to start measuring, at least you as the employer, on a aggregate basis. Are your premiums and charges going up or down?
So you're actually able to get that data then from your employees?
Yes, and I forget what the threshold is of the HIPAA laws, but we get that for all of our clients that we represent. And I'm sorry, I can get back to you on what that threshold is.
Okay.
I'll go ahead and take the second. Oops, sorry. The second part to your question is, how do you get people who don't want to be engaged? What I have found in our office is the more people who become engaged, it's like a wave. It'll start with one, and then somebody will see that one person with some kind of success. You know, they lost 20 pounds last year. And that person becomes a success story and will influence 2 or 3 more people. And then as the success stories grow, they tend to encourage other people themselves to change that lifestyle. And that is one of the things that the Wellness Champ is supposed to do, is encourage that lifestyle, to show people the success. It's not, you know, stop eating all your fast foods at once, stop drinking all the soda at once, start exercising 2 hours a day. It's those little steps that encourage the bigger steps that you end up looking back saying, I made a huge transformation. And encouraging those success stories to share their success and show everyone else in the office, how did you do this?
I think the other component to that we're exploring is the disincentive to not participating. So the research out there says if you want to get above 90% participation in a program, there has to be some negative impact for not participating. Unfortunately, it's not enough for everybody to just have incentives out there, and people say, well, I don't care. I'm just not going to participate. It's when you start putting in both the carrot and the stick model that you see that change. And it's unfortunate, but that is what the research today is showing out there on the mainland. They're doing a lot of this in the last 2 years, and that's where any company that's getting over 90% has some disincentive along with the benefits.
Okay.
Yeah, that's a great question. One more point that I kind of rushed through, and I don't know if you saw it on the screen, but I talked more about the discount or the incentive to the team, and as Travis mentioned, you can theoretically penalize people. So can you give people that participate a 10% discount, or you put 10% of the premium into a health savings account, and ultimately the person that doesn't participate, you know, their premiums might go up next year when everybody else's don't, if they don't. But what I skipped through was kind of the 5 non-discrimination requirements. You need to be very careful that it's not discriminating. So you have somebody with a disability, there needs to be alternative measures. You have somebody that's very overweight because of a disease, not just because they don't want to work out and they eat fast food and they smoke every day. If there's real legitimate health issues, the program needs to be set up so that it's non-discriminatory, or else then you're in heavy water and heat with the government. So you just need to make sure you don't discriminate and have alternate things for people that really can't participate in climbing the stairs, or they can't do the company walk, or they can't eat certain kinds of foods.
Thank you. That answered some of my questions also. But when you started your wellness program, this is for Castle, did you survey the people to find out what programs they wanted to participate in, or did you form your team and your team decided?
Yes, we formed a team, and that's one of the learnings that we've had. As we formed a team, we only included a few frontline associates, and so we have 1,000 people working. A lot of the people on the team were leadership associates, and so as a result, there was not a feeling of representation. And as we've done more polling, we've actually added associates to the team. So next year, that will be something that we increase, is polling the audience basically and saying, what do you want? We have a model that we're kind of following from our corporate sister hospitals that have worked really well, that has been driven by associates, but there is definitely a unique aspect at Castle that we're learning we need to tweak a little bit.
Okay, thank you.
As I understand, some of the activities are on company time. So my question is there an impact on productivity in the companies that you've seen? And also, if it's a negative impact, does the health or the savings in the health insurance outweigh any loss in productivity costs?
That's an ongoing debate at my hospital between finance and wellness. We do allow company time for a lot of the different activities, but currently we have not seen universally all of our directors saying, yes, I'm going to give you 30 minutes on company time to fill out your health risk assessment. We've really encouraged folks to take that home and do it, or if their division allows it to, then go ahead and, as long as they're staying within their productivity. We have not, because we've only done it for a year, we've not seen the savings yet, and I don't anticipate we're going to see those savings for some time. It takes a long time to really change a culture, but that doesn't mean you stop. You go ahead and you start investing, and it's like the parable of the bamboo that you pour water on for 2 or 3 years, and then all of a sudden it shoots up 60 feet in a few months. That's our philosophy at this point.
I think you're undervaluing the other components of this thing. You're talking about decreasing healthcare costs, but it's been routinely shown that if the employees have a collegial relationship with management, you have less turnover, so the cost may not come from the cost savings may not come from the driving down the healthcare costs. It may come in a much bigger way from stopping turnover. He just said you have one company has 5 people in and 5 people out. Every time you have somebody come in, you have to have somebody else train that person to make up that person's job if they're doing any kind of job other than the a menial flunky job that anybody you can grab off the street does it. So I think a bunch of the cost savings are going to come from employee retention.
I think that's excellent point, and it's also, we just look at it as it's kind of the right thing to do for your associates. If you take care of them and provide these programs, there are many other benefits, so thank you for pointing that out.
Hi, this is Billy on the participation comments, that people who tend to become involved and participate in wellness programs tend to be healthier. Your workforce oftentimes is an older workforce. And with an older workforce, you're having folks with 1 or more, perhaps, chronic diseases. Can you speak to any special incentives or techniques or successes that you've had in getting an older workforce, perhaps with chronic diseases, to participate? And what measurements might you employ to prove some level of success in a harder to reach population, rather than just getting people who are the worried well to participate in programs that are lots of fun and they'll do well at?
So we definitely have that bias of people who are interested in health and interested in participating in any activity are the ones who tend to gravitate to the wellness program. We have asked for the numbers, and we have looked at the numbers, and we see that population of people who are very engaged we're already well. And so we're not, in many instances, we're not reaching the population that we really want to reach. Our goal, and actually you mentioned it, Andi, a little bit about highlighting the people who have had success stories. And we've had a few really great success stories of overweight, diabetic leaders who have actually lost, 200 pounds through swimming. And we feature them like crazy. Those who are willing to share their story, we use that to build confidence for folks who maybe aren't thinking that they can do it. In addition, we give them big point packages for completing a very, like, let's say you stop smoking, and that's a goal you've had for most of your life. You're going to get maybe half your wellness points for the year from that activity. So we try to gear this to be very flexible for people who have significant challenges or a significant achievement, and encourage them to do that.
So you may tailor your program to the individual.
And this is a very, it's a very easy, the thing we're kind of surprised is it's so easy to participate. You can self-report all of this data. We're really just trying to encourage people to participate. And even then, you only have, 30% or so interested enough to go ahead and write down the points and turn them in.
In our office, there are a couple of the employees who had those health scares too. Sometimes that's what it takes, is a health scare, and then they have to evaluate their life and what can I do. And I know a woman in particular started having asthma attacks, and her doctor said, you need to get more active. So she made those little steps. She would just walk the steps. In her condo building, it was only 3 stories. She, at first, only could walk 1, then 2, and then she became that person that, you know what, if she can do it, I can do it too. So, like he was saying, it is about tailoring what you can do for those individuals that may need a little tweaking to the system.
Where this is going in the future, I don't know if we're close on time, but in the next 10 years, I've already seen some of the hospitals on the mainland doing this. They're actually assigning health coaches who aren't just there to encourage you, but are actually calling you up and saying, look, we're working with your insurer. You've been asked to go and do the screening study, get your colonoscopy, get a mammogram. You haven't done it. Or look, you're supposed to be taking these medications. We show that you haven't refilled your prescription. I need you to know you must do this if you're going to stay healthy. And it's actually gone to that level at many organizations. Which is probably, it's a different way of looking at it, but it seems to be what it's taking to get some of those folks to really, really hardwire behavioral changes.
Great. Thank you.
Mm-hmm.
I have one question. So most of our businesses in Hawaii are small businesses, probably less than 20 employees, very limited resources. So a lot of them can't afford to hire someone full-time to start and implement a wellness program. And I think many of the larger companies are able to do that. Is there a toolkit, Worksite Wellness Toolkit, or a website, or any type of resources out there where these small businesses can go to I guess, start one with very limited resources?
Well, I put my presentation electronically out, so you can use that for some of the basic tools, but maybe Matt or Andi has a...
I'm not, there's tons of websites on health and wellness and nutrition and how to participate. There's even some great apps that our employees love using that track kind of their points, and they walked the steps today and they did 20 sit-ups today, and et cetera, and even their dietary stuff. I'm not familiar right now with a kind of self-service toolkit that's one-stop shop like Quicken or something that just does it for you. But there's a lot of, again, health and wellness advisors or consultants out there now that will charge you a retainer, just hourly basis, to come in and help create a program and kind of help you get it started, that then within your company you need a champion to help motivate and keep it going and start getting the participation up. Our firm does that not only internally, but we do that for our clients. There's a lot, I think, benefit brokers out there that are starting to get into this new niche. So smaller companies don't have to pay a salary. You can just hire an advisor or an HR firm to help create a program that is unique to your industry or your set of employees.
Okay, thank you.
And not only that, for UnitedHealthcare, a lot of these programs were already in place before Hawaii came here. And it really is about, my job is not the wellness champion. That's something I do additionally to my job, and it's a committee of people. So for small businesses, it doesn't have to be one person doing everything. Get a committee together, 3 or 4 people. And I always thought that for the smaller businesses, it's a little easier, I would think, because you do get to know everybody individually, as opposed to a company like UnitedHealthcare, where there's at least 100 people in Hawaii, thousands of employees nationwide. So there are some advantages to being a smaller business trying to get into the health, trying to be healthier as well.
Thank you. We're just about out of time, but I'm going to let Lola ask the last question. Keep it brief. That would be great.
Thank you, Sherry. It's great to hear about your companies. What you're doing is based on your valuing of wellness. I have a question regarding the insurance that you provide for your employees. Within the wellness programs that you have, if an employee needs care and care coordination, as employers, do your benefits provide things like disease self-management education program coverage? I mean, have you found any gaps in terms of reimbursable costs, and how do you address it as employers?
I have there's one gap that we're struggling with, and I don't know if it's an awareness gap as well, but that's pre-diabetes. There's not a lot of coverage right now in the state for pre-diabetes coverage, counseling and services, which is a really critical area where you're not yet diabetic, but you're very close. And if you can get a hold of that, and so we have a service that we provide through our wellness center where we do this fairly low cost. However, folks who don't engage in that get to the stage of diabetes, all of a sudden, it's covered now, but the costs are escalating significantly, and of course, it's a massive lifestyle impact. So there's things that's a gap that we're focusing on right now.
Okay.
My company that represents, all these clients, we work with all the healthcare carriers here in Hawaii, and the four dominant ones, HMSA, Kaiser, HMAA, and UHA, and they all offer similar kind of programs. And what personally, my own experience, I'm already seeing with Obamacare, that's part of the good part of Obamacare, the coordinated care, centralized of records, and ultimately trying for the preventative stuff. So, there's these new 10 things that are mandatory. And most of those were already in Hawaii's plans, but across the country they weren't. And a lot of that is the preventative type things. And it's covered, and I'm already through HMSA getting calls personally myself saying, I see you see so many doctors for different things, can we start coordinating this for you? So you don't have to do blood tests 6 different times for 6 different doctors. So I'm already seeing the impacts of Obamacare on our local insurers in trying to be much more preventative, because if they can handle the issue sooner than later, it's ultimately going to be a lot less in cost to address the issue now than when it becomes a chronic disease down the road. So I've been impressed, at least with the 4 major carriers so far, of really trying to use that piece of Obamacare. There's so many pros and cons of it, but that piece to accelerate their coordinated efforts.
Thank you, Matt. Well, we're out of time, but please join me in thanking our panelists, Andi, Travis, and Matt. So it's lunchtime. You can return to the main dining ballroom for the plenary luncheon. And